The funding of the health care law. As you heard from our guest earlier this morning, the House Speaker John Boehner to meet with the caucus at noon today to debate the next steps. Stay close to C-SPAN. Stay close to cspan.org. Here's the House of Representatives.
The House will be in order. The Chair lays before the House a communication from the Speaker.
The Speaker's Rooms, Washington, D.C., September 28, 2013. I hereby appoint the Honorable Chris Stewart to act as Speaker pro tempore on this day. Signed, John A. Boehner, Speaker of the House of Representatives.
Pursuant to the order of the House of January 3, 2013, the Chair now recognizes members from lists submitted by the majority and minority leaders for morning hour debate. The Chair will alternate recognition between the parties, with each party limited to 1 hour and each member other than the majority or minority leaders and the minority whip limited to 5 minutes each. But in no event shall the debate continue beyond 11:50 a.m. The Chair recognizes the gentleman from Oregon, Mr. Blumenauer, for 5 minutes.
Thank you, Mr. Speaker. We are here in the Capitol awaiting a decision by the Republicans in the House about the next step to deal with the fiscal crisis they have created. It's not really that complicated. The Monday deadline approaches to continue the operation of the federal government with a shutdown looming because the Republicans have refused to work on a bipartisan basis to resolve the funding issues. The centerpiece of their rhetoric has been objection to the Affordable Care Act and their childish insistence that a program that has been approved by Congress, President Obama re-elected defending, and validated by the Supreme Court, that somehow this bell can be unrung. Billions have already been spent. Hundreds of thousands of people are working to make the reform operational, and it seems to be working. Better prescription drug benefits for senior citizens are putting more money in their pocket. Children under the age of 26 have been able to stay on their parents' policies. Beginning Tuesday, enrollment starts for the exchanges, and on January 1st, it goes live with better health insurance. People can't be refused insurance for pre-existing conditions. There will be no lifetime limits on benefits. Health insurance will be more affordable with subsidies for millions, and there will be more competition for all. These provisions are overwhelmingly supported by the American public. The health insurance program will save billions of dollars for the federal government, reducing the deficit. That's the judgment of the CBO. In fact, isn't it ironic that having campaigned against these health care savings and losing, Paul Ryan and the Republicans include those very savings in their budget? My Republican friends are paralyzed in part because they've adopted a draconian budget that actually requires savings in the very health plan they want to defund. Now, they claim to want to reduce government spending, yet they have refused to allow the House to vote on the spending bills their budget calls for. We have been waiting for 2 months to finish the transportation and housing spending bill. They got halfway through it on the floor of the House, and they realized that their own members wouldn't vote for it because it was so awful. And they stopped. They didn't even bother to bring the interior spending bill to the floor. Now, if their budgets are so bad that their own members won't vote for them, they shouldn't throw a tantrum, threaten to shut down the government, or destabilize the global economy by playing games with the debt ceiling. If they're afraid to have their own members vote on their spending bills, shouldn't they allow a conference committee between the House and the Senate to resolve budget differences? That's how the system is supposed to work. They whine the President won't negotiate with them. How is the President supposed to deal with people who are unwilling to face up to the consequences of their own irresponsible budgets, or refuse to allow Congress to work the process to establish a consensus budget by having a conference committee? How are Democrats supposed to deal with the Republicans as they up the ante, seeking to damage the American people by cutting off vital services in a shutdown? How do you deal with Republicans who are willing to default on paying Americans' debt, breaking our moral and legal obligations, and risking not just America's, but the world's economy? Earth to my Republican friends, America pays its bills. Always has, always will. It is the height of hypocrisy to blame this on the President, the Affordable Care Act, or the Democrats. We wait breathlessly to see if Republicans can agree to have anything to be voted on today, but the American people should insist that if my Republican friends are serious, they should bring their own budgets to the floor, allow the process to work to have a conference committee between the House and the Senate to reconcile our differences. Then we can act like grown-ups, not children throwing tantrums, and we wouldn't need to threat the global economy over the debt ceiling. Thank you, and I yield back.
The gentleman yields back. The chair recognizes the gentleman from Texas, Mr. Williams, for 5 minutes.
Thank you, Mr. Speaker. Yesterday, the President yet again chose to bash Congress and blame the House Republicans for the failure of America's economy. I've seen him make this argument on television many times, but he never shows up on Capitol Hill to actually engage in productive conversations. He does talk, however, to the Russians, the Chinese, and the Iranians. This is no surprise. This is the same man who spends more time with Hollywood stars than members of Congress. It's not Congress that will shut our government down. It's our President. And I will argue that he already has shut the government down. 5 years ago, unemployment was at 5%, and the national poverty rate was at 12.5%, and approximately 30 million Americans receive food stamps. Today, unemployment sits at 7.6%. The poverty rate exceeds 15%, and a staggering 47.8 million Americans are enrolled in the food stamp program. And 48 million people between the ages of 18 and 64 have not worked one day the last 12 months. The President's economic agenda is only pushing us further into danger, and it's a disaster. For more than 4 decades, I have owned my business, and I can say with certainty that today's economy is the toughest economy our country has seen from a small business standpoint. Everything from health care to taxes to regulations are killing businesses and forcing job creators to play defense. Rather than generating profits, businesses are saving profits. This isn't the sign of a rebounding economy. Despite this, in his public address to the nation, President Obama said the economy has gained traction and continued to place the blame on Congress. What the American people need to hear are solutions, not sound bites. As a business owner, I know what it takes to create jobs. I live it every single day. First, we need true tax reform. Lower taxes mean more taxpayers and more income. More specifically, we need to cut taxes for all taxpayers across the board and quit picking winners and losers. The first step in doing this is cutting the corporate tax rate, the personal tax rate, the capital gains tax, the dividends tax, and eliminate forever the inheritance tax. The next step is to begin a dialogue on whether we should move to a fair or a flat tax. Either one of these is certainly better than what we have today. Second, we need to change health care policy. With the addition of Obamacare, the government now comprises 1/6 of the nation's economy. This is a complete travesty, and the private sector must be given more control of health care, not the federal government. Consumers should be able to shop across state lines, which will create more competition. As a result, premiums would go down and services go up. That's what competition does. Consumers also need to own their own health care, not their employer and not the federal government. And it needs to be tax deductible. It needs to be portable so you can take it with you if you retire, you lose your job, or move around. Third, we need to energize the energy business and not penalize the energy business. Let's favor an all-American approach for all sources of energy and let the private sector drive our energy, not our government. We do this by reducing regulations, letting the industry drill, and promoting the advancement of safe nuclear and alternative energy sources. Let the private sector tell us where to go. Developing our domestic energy sources will undoubtedly lower energy prices for families and businesses. Finally, we need to ensure America remains the world superpower with a strong and well-equipped military. Our men and women in uniform must have the best equipment, must have the best training to fight for our freedom and our liberty. It shouldn't even be an option to balance our nation's books on the backs of our military. Doing so diminishes our military's readiness and threatens our national security, and it simply shows weakness across the world. These are real solutions. They will allow businesses big and small to invest, to take risks, and they also will be rewarded. They show that the federal government believes in the private sector, believes in entrepreneurship, and believes in people getting checks, and lets everyone feel good about themselves. We should never accept 7.6% as the normal level for unemployment. We should never accept a 15% poverty rate. We should never accept $2.5 billion in free cell phones. We should never accept 15% underemployment. We should never accept 52% of our college graduates who are either underemployed or can't get a job. And we should never accept an economy that creates more food stamps than jobs. It's time to wake up, America. Big government has taken a toll on our families, our businesses, and our budgets. Let's get back to regular order in Washington and start passing responsible budgets that give our nation much-needed certainty and security. Business and families do it every single day. There is no question that America is the greatest country in the world. In the unforgettable words of Abraham Lincoln, America is the last best hope on earth. Let's keep it that way by believing in the people and not the federal government and not big government. And let's say goodbye to Obamacare, the largest takeover of the people by the government we've ever seen in our history. It's truly our generation's Valley Forge. Let's be shepherds and not sheep, and let's be patriots and not victims. God we trust. Thank you very much.
The gentleman's time has expired. The chair recognizes the gentleman from New York, Mr. Tonko, for 5 minutes.
Thank you, Mr. Speaker. Mr. Speaker, I have one basic question. What are we doing here? I mean just that. What are we really doing here? Each day we talk about problems, the real problems that face our country, that are fixable with compromise and clear-headed solutions. And each day this chamber does nothing to overcome those challenges in front of us. And each day the American people think we can't sink any lower or be any more dysfunctional. Right now there's talk about passing a one-week budget to simply provide the time for elected officials, people charged with running the government of this great nation of ours, to get along for enough time to pass yet another extension. Say it isn't so. 1 week. There are lemonade stands with better budgeting practices than what we've seen in this body in the past 2 years. This is unacceptable. This is absurd. And this certainly is not what the American people deserve from any layer of government, especially their federal government. Let's get this done. Let's pass a budget that cuts where we can, that invests where we must, that grows jobs, and ends the painful consequences of sequestration. The absolute misery here is that all of this dysfunction could have been avoided. We could have avoided the reach to yet another kicking of the can down the road if we would come together at the conference table and do a real budget. We could reach to a budget process. We could reach to regular order. I have requested with many of my colleagues, I have urged with them that the leadership in the House resort to naming the panelists who will sit at that conference table to realize regular order through a budget process, a real budget process. That request has been turned down time and time again. The statements made in the past were, well, the Senate hasn't moved on a budget, or we haven't heard from this entity about what their plans are. Well, the truth be told, this year, the Senate, the United States Senate, passed its version of a budget. This House passed its version of a budget. The President and his administration have advanced their fiscal blueprint for the coming fiscal year. The entities have spoken. The process needs to be addressed and respected. We need to bring those panelists to the conference table, those who will represent Republicans and Democrats in the House of Representatives, in the United States Senate, to come to terms, to develop the compromise, the spirit by which our founding parents developed this wonderful blueprint of a republic guided by the democracy. Why are we rejecting that opportunity? A sound budget could allow us to escape the terrible consequences of sequestration. I have witnessed what that sequestration has meant in my own district. During our 5.5-week district work period, I visited with many of those Head Start programs, with early intervention, with nutrition programs, with food banks that address the nutrition needs of people of this great nation. I have worked with the small business community to understand more fully what the impact of sequestration might mean to them. Cuts to research, programs that have furloughed my federal employees if given the opportunity to serve this nation through their workforce. All of that consequential damage could be avoided if we would resort to the soundness of the tool called the budget. The sequestration issue is painful. It's a hidden attack. It's mindless. It's thoughtless. And it's pervaded itself into the fabric of our communities, into the quality of life of the people that place within us the trust to be their voice in Washington. And so we need to do better than this paralysis that has stalled the process, that finds us in a midnight hour searching for answers in the most unusual format, that will resort to yet another kicking of the can down the road, that will use the smoke and mirrors to balance a budget for some uncertain period of time, that doesn't provide the predictability to the business community or to the working families of this nation. The partnership with their government should be real. It should be stated in terms that allow for the respect of businesses to invest and hire and be productive. And so we have had a plan in this House coming from the Democrats. Representative Van Hollen has introduced a plan that will reduce the deficit in greater fashion and avoid the painful consequences of sequestration. With that, Mr. Speaker, I yield back.
The gentleman yields back. The chairwoman recognizes the gentlewoman from Tennessee, Ms. Blackburn, for 5 minutes.
Thank you, Mr. Speaker. And I want to begin my remarks to just make a couple of comments about the budget process. I think my colleagues could be a little bit confused on this, and I will remind my colleagues it is this body that every single year meets our statutorial duty and our constitutional duty to bring forward a budget that funds the operations of the United States of America. We do not miss our deadlines, and this year we did it. I know that the White House did their Sweet 16 bracket before they did their budget, but you know, we were still pleased to see that they were willing to participate in that process, and we were pleased that our friends in the Senate, for the first time in 5 years, decided they would enter into the budget process. We were very disappointed, quite frankly, when they said they would not move to the conference table with us until we agreed to a tax increase. Now, that is what they want, is an agreement to a tax increase in this kind of economy with about 8% unemployment, with 20 million Americans either un- or underemployed. They want more taxes, more control over people's lives. We were not willing to do that. We are continuing to stand and fight for the American people, for responsible government, for getting this budget balanced within the next decade, and for getting this country back on the road to fiscal health. Now, I will also remind my colleagues that one of the things we continue to hear from this White House and this administration is that they want a government shutdown. Now, they try to blame us. We realize that, but I got to tell you, I've got a titanium backbone. Let them blame, let them talk. It's fine. They want the government shutdown, and for my colleagues, I would direct their attention to the Congressional Research Service for the summary of what happens in a government shutdown. Now, for the interest of my colleagues, Mr. Speaker, I will just walk through some of these points. One of the reasons they want it is because the President wants control of the checkbook. Right now, the U.S. House of Representatives has that control, and we want to keep it. We don't want a government shutdown. We want to keep the government open and keep cutting it. We want to keep the government open so we can delay, defund, repeal, and replace Obamacare. And this budget process, going into a shutdown, gives control to the administrative branch. There's another little tidbit when you read the circular, and it directs you to the 2011 revision of Circular Number A11. OMB's current instructions would have agency heads use the DOJ opinions. Department of Justice, I can tell you the American people in a Republican-led House do not want Eric Holder and Barack Obama making the determination of who and what will be open in this federal government, what will be funded, and what agencies are going to be working. We don't want to give them that response. I know they want that. I know they're trying to get a government shutdown, but I have to tell you, that is not what we want. Now, what we are for, as I said, is making certain that we protect the future and the financial solvency of this great nation. And one of the reasons we have worked so diligently on budget for this body is because we know the cost and the impact that Obamacare is going to have on the nation's fiscal health. And we are very concerned about it. We see what is happening in our communities. And I just want to reference some of the correspondence and conversations I'm having with my constituents in Tennessee. Yesterday, I spoke with a gentleman who went to a check cashing store, borrowed $400, started a retail business, now has 45 employees and 5 locations. Great business, great business. And what he is looking at is he can't expand. He can't hire anybody else. He is having to deal with all the hoops that really weigh this business down, and it is because of Obamacare. I know my time has expired, and I yield back.
The gentlewoman yields back. The chair recognizes the gentleman from Connecticut, Mr. Himes, for 5 minutes.
Thank you, Mr. Chairman, and I'm happy this morning to be able to follow the rank partisan remarks of Ms. Blackburn, because I wanted to speak this morning on the subject of compromise. Compromise is not an easy subject to speak on because, of course, we all have it in our minds here that the right thing to do is to lead great ideological battles, to stand unbending by your principles, to stand up for what you think is right. And it is the right thing to do to stand up for what you think is right. Compromise is a hard thing to discuss because, of course, those on the fringes, those on the extreme, those who are unbending will accuse us of not standing by our ideals if we compromise. But the fact is that most, if not all, of the accomplishments in the history of this country that have been achieved by the United States Congress have been achieved through compromise. Let's talk for a moment about one of the reasons I'm happy to represent the state of Connecticut. The Congress in which Ms. Blackburn and I serve, the very structure and architecture of that Congress was formed by something known as the Connecticut Compromise of 1787, when Roger Sherman and a group of people who disagreed on stunning issues of the day, or some of the people who were disagreeing were inviting foreign powers in to stand with them, they came together and said, you know what? We'll have a bicameral legislature, a Senate and a House that will balance the big states and the small states. And Roger Sherman's statue is here in the Capitol. By the way, the Capitol is here because Madison and Jefferson and others of our founding fathers made a compromise where they said the federal government will assume the remaining revolutionary debt of the states in exchange for putting the Capitol in the southern states. Compromise is how we get things done around here. Those who might challenge my own credentials on compromise, I will point out that I was one of 38 members of this body, less than 10% of the House of Representatives, that voted for the Simpson-Bowles budget. Everyone else said, no, I'm not going to compromise, because that's too difficult. So what about the crossroads where we find ourselves today? Possibility of a government shutdown that would hurt our economy and certainly hurt an awful lot of Americans, and the even more egregious possibility that we would not honor the full faith and credit of the United States government for the very first time in our 240-year history. Is this a great national battle between North and South, between Republicans and Democrats? No, it is not. It is something far more unnecessary and uninspiring. On one side of this debate, we've got actually the majority of Republicans and the majority of Democrats who say, let's come together. Let's not bring an unnecessary crisis to our country, a manufactured artificial crisis. Let's compromise. On the other side, you've got a handful, maybe 3 or 4 senators, maybe 30 or 40 members of the House of Representatives who are so possessed of the Lord's wisdom, they so embody the tradition of our founding fathers that they will listen to no one and they will refuse to compromise. But who are these people? These are people that believe that the best way today to spur economic growth is to put in place savage cuts that will fire teachers and firefighters and nurses, because that will help, despite all evidence to the contrary. These are people that believe that the storms and the tornadoes that have ravaged just about every state in this country have absolutely nothing to do with climate change, despite all evidence to the contrary. These are people who believe that Obamacare today is doing great damage to this nation, despite all evidence to the contrary. These are people who don't believe that the President of the United States was born in this country, despite all evidence to the contrary. Mr. Speaker, so much could get done. Comprehensive immigration reform, a budget that looks a little something like the Simpson-Bowles budget for which I voted. So many things could get done, Mr. Speaker, the gentleman from Ohio, if you would set aside this small rump group of dead-enders and say, we will govern. We will govern this nation in the tradition of Roger Sherman, of James Madison, of Thomas Jefferson, by listening to the other side, by shutting down the extremes and thinking about the long-term interests of this great country. Mr. Speaker, with that, I yield back the balance of my time.
The gentleman yields back. The chair recognizes the gentleman from California, Mr. McClintock, for 5 minutes.
Thank you, Mr. Speaker. A crisis is not a good time for inflammatory rhetoric or ad hominem attacks. I believe that my colleague from Connecticut just missed the mark a moment ago when he threw out terms such as dead-enders and extremists. And I'll simply say that yesterday the President missed an opportunity to bring both sides together. That responsibility now rests solely with us. Nobody on the Republican side of the aisle wants to see a government shutdown or a credit default. Let's make that clear. And I'm confident that nobody on the Democratic side wants to see millions of Americans lose the health plans they were told they could keep, or see the health care costs skyrocket, or lose their jobs or work hours because of the unintended consequences of Obamacare. But these events, and that nobody wants to see, are now unfolding. They will do great damage to our nation that nobody wants to see happen. If we agree on these fundamental issues, our course should be clear, and it's only blocked by the kind of partisan division that we heard yesterday from the White House and a few moments ago. We can avert these calamities and redeem this institution if we can put aside the name-calling for a few days and get down to business. The good news is we have a process of government that's evolved over centuries, that's very good at resolving differences of opinion between the two houses of Congress and within the two houses of Congress. And in this case, there shouldn't even be much to resolve. All of us want to see the government stay open. All of us want to see the government's credit preserved. All of us want to see Americans protected from losing health plans that they want to keep, or from being socked with crushing premium increases, or from losing their jobs or having their hours cut back. If we're all agreed on these objectives, isn't the appropriate course self-evident? Senator Manchin seems to have laid it out very clearly the other day. A temporary continuing resolution to keep the government open, a temporary increase in the debt limit while we complete the normal appropriations process, and a temporary delay in Obamacare until the unintended consequences of its mandates can be corrected. Is that so unreasonable? After all, this administration's already exempted big corporations and more than 1,000 politically connected groups from Obamacare mandates. More revealingly, the administration's protected members of Congress from its crushing costs. That ought to be the ultimate wake-up call. If members of Congress can't afford to meet Obamacare's costs, how do we expect the average American to do so? Why not give everybody the same relief by delaying these mandates until the law can be replaced with provisions that actually fulfill the promises made to the American people when it was enacted? I don't like continuing resolutions at all. Congress has a responsibility to superintend the nation's finances, and it's developed an appropriations process that requires painstaking review of every expenditure of this government. That review involves countless hours of committee work, scores of hours of floor debate, and hundreds of individual amendments. Continuing resolutions cast aside this work and abandon Congress's responsibility over the nation's finances. They shift enormous authority to the executive branch that the founders never intended. I had hoped to be done with continuing resolutions. Those who enacted Obamacare, no doubt, hoped it would lower health care costs and help the economy. Sadly, events in this imperfect world can often disappoint and transfigure our fondest hopes. We've not completed the appropriations process. We need additional time to do so, and we need to correct the damage being done to existing health plan holders and employees by Obamacare. If we could all agree on these objectives, then our course should be clear to all of us. We should fund the government long enough to complete the normal appropriations process, and we should delay Obamacare long enough to preserve the jobs, working hours, and existing health care policies of the millions of Americans who are now losing them. So let's cool the rhetoric and do what this institution is designed to do. Come together in support of the objectives upon which we all agree for the good of the nation and the people who have entrusted us with its care. I yield back.
The gentleman yields back. The chair recognizes the gentleman from California, Mr. BERA, for 5 minutes.
Thank you, Mr. Speaker. 3 days. In 3 days, this body threatens to shut down the government. A government shutdown is going to affect millions of Americans. A government shutdown is going to affect middle-class families at a time when our economy is slowly recovering, at a time where people are just starting to feel a little bit better about their home values, at a time where my constituents in Sacramento County are just now starting to feel a little bit better. Mr. Speaker, we can avoid this. Let's do what our history has shown us we can do. President Ronald Reagan was able to work with Speaker Tip O'Neill and get something done. That's what happens in divided government. President Bill Clinton was able to work with Speaker Newt Gingrich and get something done. That's what happens in divided government. You work together. You listen to each other. You don't play this blame game. You act like adults. Let's start talking and let's start listening to one another. That's what the American public wants. They want Democrats and Republicans to bring their best ideas forward, put those ideas on the table, and put the people first. It's not that hard to do. That's what we teach our kids to do. That's what we do for those of us that have worked in the private sector. That's what American families do every day. They learn how to work together. Now, the House is controlled by Republicans, the Senate is controlled by Democrats, and President Obama was reelected as a Democratic president. This is divided government. So, Mr. Speaker, sit down with the President, sit down with the leadership, put the best ideas forward and compromise. We can't operate in a my way or the highway mentality, a winner-take-all mentality, because that's killing this country. The public is watching, and in these next 3 days, I hope this body acts like adults and we don't start playing the blame game, saying, oh, it's the Republicans' fault, oh, it's the Democrats'. You know, that isn't going to get us anywhere. Yesterday, the Senate passed a continuing resolution to keep the government funded for 2 months. That isn't a solution, but at least it gives us 2 months to act like adults and put together a real budget. Because at its core, that's what we need to do. The #1 job for elected officials, for all of us in this body, is to put together a real budget that takes the best Democratic ideas and the best Republican ideas, puts them together, and puts the American people first. Now, we can listen to all the rhetoric that says, oh, the House has passed a budget and we did it on time, the Senate's passed a budget, the President's passed a budget, but the sad fact is all 3 budgets are different. How do you operate a business like that? How do you manage your household like that? Let's act like adults and let's go to conference. Let's take those 3 budgets. Let's figure out a solution and a compromise and agree on one budget. And then bring that back to this body. So yes, the Senate passed a continuing resolution. Mr. Speaker, I'd urge you to bring it to this body today. Give us a chance to vote up or down. If you don't like that resolution, then the Republicans control the House. They'll vote down on it. But give us a chance to vote on it, to vote up or down. That's how this should work. The Senate's passed a farm bill. That's important to this country. It's important to my constituents in California and in Sacramento. Give us a chance to vote on that bill up or down. That's how government should work. We've got to start coming together. Now, there are a group of us that are working together. I'm a leader of a group called the Problem Solvers. It's now up to 83 members. It's Democrats and Republicans. We don't agree on everything, but we listen to one another. We put our ideas forward. We want government to work. We want to fix problems, not fight. We want to actually take those ideas. One of the first bills that I passed and I co-sponsored was No Budget, No Pay, which says if we don't actually put a budget together, why should members of this body, why should members of Congress get paid? Nobody else in America gets paid if they don't do their job. Well, this body's not doing their job. No budget, no pay, and we passed it. The Senate passed it, the President signed it into law. So let's actually pass a budget. So if we get 2 months, if we get 3 months in funding the government, let's use those 3 months wisely to pass a budget. The public is watching. Here's 3 things that we could do. #1, go to a conference committee. The Senate's appointed folks to talk about their budget. The House has not appointed those folks. Let's get this done, and let's start moving America forward and relieving the debt burden on our kids and grandkids. We could do this. The public is watching. 3 more days. I yield back.
The gentleman's time has expired. The chair recognizes the gentleman from Pennsylvania, Mr. Fitzpatrick, for 5 minutes.
Thank you, Mr. Speaker. I rise first to thank my colleague and friend from California, Mr. BERA, for recognizing that in divided government, which we've had in the past, it's important that we sit down, resolve differences, and we negotiate. And he correctly pointed out that President Reagan in the 1980s was willing to and quick to negotiate with then Speaker of the House, Tip O'Neill, and they accomplished great things. They reformed the tax code in 1982 and 1986. They reformed Social Security by working with Tip O'Neill and Senator Moynihan from New York. And then 12 years later, President Clinton was willing to sit down and speak with then Speaker of the House, Newt Gingrich, and they performed important things for this country. They reformed welfare and they balanced the budget. And those things weren't easy. Those things took resolution, took resolve, it took willingness to sit down and talk to each other. But here we are in the year 2013, and many of us on this side of the aisle are feeling like we don't have government that's willing to sit down and negotiate. As a matter of fact, this morning it is reported in The Hill, the headline says, Obama to Republicans, I will not negotiate. And so here we are at the 11th hour, ready, willing to compromise, to negotiate, with a commander-in-chief and chief executive that will not negotiate with us. What you need in order to compromise many times is time and space. And I'm here today, Mr. Speaker, to express my support for delaying the Affordable Care Act by at least 1 year. Since the law's passage, time has shown that the Affordable Care Act is a misguided effort which has divided Americans on the common goal of affordable access to world-class health care, as opposed to bringing us together to rise to the challenges that we face as a country. What has most of us deeply troubled is that not only will the law leave over 30 million Americans uninsured and forced to pay a tax, but it is forcing physicians to fundamentally question the nature of their profession and its pursuit. The role of the doctor fundamentally changes under this law. As opposed to being a healer, doctors are now bureaucrats. The law erodes the core of American medicine, defined by exceptional medical care practiced by highly trained experts who are driven to innovate and improve for the common good. Instead, this law leads to medicine by bureaucrat and checking off boxes. As for the 30 million who will remain uninsured under the law's design, they will continue to be left outside the health care system. Compounding matters, the law also creates countless newly uninsured Americans, something the President told us would not happen, but it is happening in the 8th Congressional District of Pennsylvania, with workplaces struggling to deal with the law's overreach and the law's burdens. Additionally, former President Clinton has highlighted another 500,000 Americans who will become uninsured due to the President's health care law, children. He's referring to it as the family glitch, where the law's complicated formula removes children from their parents' health insurance, leaving them without coverage. Furthermore, nearly 1/3 of those children will not qualify for Medicaid or for CHIP. Glitch, this is a catastrophe. Both the intended and the unintended consequences of the law are far-reaching and will not be fully understood until this week as Americans begin to live under this new system. As was said during the health care debate by the law's supporters, we have to pass the law to find out what's in it. That is the prevailing attitude by people in the Beltway who have continued to put themselves between patients and doctors, workers and workplaces, students and teachers, and families and their faith time and time again. One of the keys to our nation's success is the manner we have adopted to solve problems. It is hardwired into our culture of freedom. Americans believe we can solve our own problems and are more apt to work together when we know the solutions lie in our hands, not in somebody else's. This is what makes America exceptional. While many of us agree that there is some good in the law, there is no telling what else we're about to find out about the health care law and its impact on families, workplaces, and the economy. And that's the problem, Mr. Speaker, in a nutshell. As Congress struggles to deal with the costs and presumably unintended consequences of the health care law, Americans need answers, and they need answers now. At a minimum, glaring deficiencies like these are reasons for pause. All policymakers, including the President, should take a step back and delay the law's implementation for at least a year to ensure that Americans are being helped and not hurt. I yield back.
The gentleman yields back. The chair recognizes the gentleman from Illinois, Mr. Davis, for 5 minutes. Without objection.
Thank you, Mr. Speaker. You know, I believe that Obama does in fact care. And that care is evidenced by the fact that we passed the most major piece of health legislation that we have done since the mid-1960s, since Medicare and Medicaid. And so it's amazing to me that I continue to hear colleagues in both the House and the Senate who are attempting to deny the existence of this legislation. Legislation that was passed by both houses of Congress, signed into law by the President of the United States of America, upheld by the Supreme Court, who says that it is indeed constitutional, and still there are colleagues trying to deny the existence of this law. That is amazing. As a matter of fact, it's real, it's passed, it's been affirmed, and it's going to stay. My county government, Cook County government, has already, with a waiver, signed up more than 100,000 people just waiting to get enrolled into its county care program. 100,000 people, none of whom will have to worry about pre-existing conditions. 100,000 people in Cook County, none of whose children under 26 will have to worry about having health insurance coverage because they can have it on their parents' policies. 100,000 people, none of whom will have to worry about running out of benefits. 100,000 people in Cook County, one county, who will have their own primary care physician, who will be able to see a doctor and go to the clinic on a regular basis. But that's nothing compared to the more than 30 million people in this country who, for the first time in their lives, will have health insurance coverage. I hear all of the discussions about the negative impact. Well, you ask a person in need of health care, never been able to get it, how much negative impact it's going to have on them. I agree that the Senate has passed a continuing resolution which does not fund the government for the extended period of time that we'd like to see and need to see. But I can tell you I'd rather have that than to have people worrying and wondering whether they're going to be able to see a doctor when they need to see one, or go to the hospital, or take their child to a regular doctor rather than having to go to the emergency room. So I would urge my colleagues, let's be in agreement. Let's be in agreement with the Senate, and let's move right now, today, if not today, tomorrow, to pass a continuing resolution that keeps our government funded. Thank you, Mr. Speaker, and I yield back.
The gentleman yields back. The chair recognizes the gentleman from Missouri, Mr. Smith, for 5 minutes.
Thank you, Mr. Chairman. Mr. Speaker. Mr. Speaker, Deficit Day is the symbolic day each calendar year when the federal government runs out of money and begins adding to the already enormous debt. Despite the $2.7 trillion the government is estimated to collect this year from taxes, tariffs, fees, and other sources, on a calendar year basis, the money ran out this past Wednesday, September 25th. As the debt limit approaches in mid-October, the federal government continues to spend money it does not have on things that Americans do not want. Washington is projected to spend over $10 billion per day, and from this point until December 31st, every dollar that it spends from this point on adds to our enormous national debt, which is already nearly $17 trillion. In the last 4 years, Congress has raised the debt limit 7 times. And today, the debt for every man, woman, and child averages over $53,000 per person. Mr. Speaker, families and small businesses from across the United States are forced to live within their means. The federal government should be held to the same standard. If my friends back in my home state of Missouri can successfully balance their budget each year, we should be capable of doing the right thing here in Washington, D.C. That is why I introduced an amendment to the Constitution to require the government to produce a balanced budget each and every year. Mr. Speaker, I look forward to working with all my House and Senate colleagues to pass a budget, to balance a budget, and reduce our national debt. I ask for unanimous consent to enter into the record an article which appeared in Wednesday's Wall Street Journal entitled, "Happy Deficit Day, Uncle Sam."
Ordered.
Thank you.
The gentleman yields back. The chair recognizes the gentleman from Colorado, Mr. Lamborn, for 5 minutes.
Just permission to address the House for 5 minutes.
Without objection.
Mr. Speaker, I rise today to urge my fellow members of Congress to delay Obamacare for 1 year. President Obama has already delayed the employer mandate, and now he has delayed the opening of the small business exchanges. He has already signed into law 7 changes to the health care law. It's clear that Obamacare is not ready to be rolled out. One of my constituents, Nicole, who manages her household budget for her family of 5, called me recently to say her health care premiums are skyrocketing as a result of Obamacare. Her insurance company notified her that her family's monthly premiums will go from $431 to $1,003. Her insurer told her that under Obamacare she might qualify for subsidies to offset that increase. But Nicole, like many Americans, doesn't want a subsidy. She doesn't want to take a government handout. Her family is responsible, self-reliant, and they don't want to be bailed out by their neighbors. The federal government is broke and cannot afford another large entitlement program, even if Obamacare would work, which it won't. It's time to admit the obvious. Obamacare is not ready for prime time. Let's delay it by at least 1 year and protect millions of Americans from its harmful effects. Thank you, Mr. Speaker, and I yield back.
The gentleman yields back. The chair recognizes the gentleman from California, Mr. LaMalfa, for 5 minutes.
Mr. Speaker, as we all know, we have important deadlines approaching this coming Monday on our budget fiscal year, the Farm Bill, as well as what we see impending with the Obama healthcare takeover of the exchanges implementation. What do we get a lot of around here? Drama. Lots of drama. From the left, from my colleagues on the other side of the aisle, from in the press, saying government shutdown, government shutdown. My daughter, who's in school, she tries to avoid drama at school with her friends and stick to what she knows she needs to get done. Yet around here, that's a pretty big byproduct instead of the work we should be doing, a lot of key things to make our country run better, fiscally sound. That would be, for example, working towards actually balancing the budget long term. What I see the plans are coming from the White House over in the Senate, there is no plan to move towards a balanced budget in the future. It's going to take hard work. It's going to be difficult. There'll be a lot of infighting and caterwauling in this place in order to try and move to that direction. But Republicans actually offer a plan to, in the future, move towards a balanced budget, to make those lines finally come together after many, many years of overspending. We don't see those ideas come from the other side. Unfortunately, we're not going to get out of this pattern of having to raise the debt ceiling until we achieve the balanced budget that we need so direly in this country. That's a dirty little secret. Debt ceilings are going to be part of our future until we can truly get to balance. So real solutions are needed that move us in that direction. Not more drama. Mr. Speaker, stop the drama. And let's get together and work on these solutions. I heard my colleagues on the other side of the aisle talking about this morning. Let's do real budgets instead of CRs. I don't like doing continuing resolutions either. I guess it's a way to keep the government open in the meantime until we can come to agreement, but we have to have some kind of fiscal reality that says that we can't keep spending more than we take in. We can't keep implementing a program like the Obama health care takeover that's killing jobs, that's giving people less choices on their health care, that's running doctors out of the business. It's no fun for them anymore when they see this coming down upon them. Let's go to free market approaches. Let's go to what the Republican Study Committee is working on with the American Health Reform Act, which gives people choices, which actually addresses the high-risk pools and allows people that are in a permanent situation needing long-term health care to find those solutions. Instead, we get something that we know, we see, is not going to work. Look at all the delays in the implementation of the health care exchanges. Delay after delay after delay. Yeah, we need delay because it isn't working. So instead, we hear threats, government shutdown, you Republicans are doing this, you're doing that. Mr. Speaker, let's stop the drama and get to the real solutions. Let's do the math on the Obama health care takeover, how it's not going to work. Let's do the math on how the CRs are not really a solution but a temporary measure. Let's do the math on getting towards a truly balanced budget sometime in the future that the Republican House has offered and doesn't seem to be coming at all from the White House when we've asked the White House, do you have a plan to balance the budget? Or the Senate, do you have a plan to balance the budget? Ever. We don't see them. We have to balance them in our own personal lives around our households, our businesses, yet why does government continue to have a blank check to get away with it with the taxpayers' money, with the taxpayers' future? How many trillions of dollars of debt do we have to get to before we're actually going to learn this lesson that we're going to leave for the coming generations? I want to be part of a solution that moves these lines together so we get to a balanced budget sometime in the near future, not never. This nation requires it. If we want to have jobs, we want to have the prosperity that we once knew, we need to go back in that direction. So, Mr. Speaker, I ask this body, I ask our colleagues in the Senate, I ask the White House, let's stop with the drama. Let's get back to the table and negotiate. When our President says he will not negotiate with us, the American public should be appalled that in the process of the give and take of the institutions our founders set up here with these three branches of House, Senate, and White House, supposed to get together, compromise, hammer things out, argue, get along, all those things, that when one branch of that does not want to get together and even talk and compromise, but instead is willing to be on the phone with Iran or Russia and not our own colleagues, we should be appalled. Let's get back together. Let's stop the drama of the name-calling, of threatening government shutdown, where Republicans are not moving towards that at all, but actually trying to find solutions. Let's get it done for the American people. I think the American public demands that. Let's have solutions. Mr. Speaker, I yield back.
The gentleman yields back. The chair recognizes the gentleman from Pennsylvania, Mr. Thompson, for 5 minutes.
Thank you, Mr. Speaker. Mr. Speaker, the President in his remarks to the country yesterday demonstrated a willingness for diplomacy and negotiations. Sadly, any leadership he reflected in his remarks was a willingness to communicate and negotiate with the terrorist states of Iran and Syria, and not the United States House of Representatives. What the President also made clear was his unwillingness to serve the will and the concerns of the majority of American citizens, families, and businesses when it comes to their health care. Health care is one of the more intimate issues in America. There should be no surprise of the emotional reaction and rejection by the majority of the country when this legislation is passed unilaterally by one party without adequate debate or vetting and mandated on 311 Americans. The September 4th to the 23rd Real Clear Politics compilation of 7 major national polls show that an average of 52% of Americans are opposed or against the Affordable Care Act, while only 38.7% are for or in favor of this law. Mr. Speaker, I understand the political divide that unfortunately exists in Washington, but what I do not get is how the President ignores the will of the majority of the American people. We expect leadership from the President, but there is no leadership when the direction you want to take the country is rejected as the wrong direction by the majority of American citizens. Now, some have said that the Affordable Care Act is the law, so just implement it. Well, that makes a dangerous assumption that Congress never gets it wrong. History certainly shows precedents that Congress can and has corrected the mistakes that it has made. Prohibition, which was repealed in 1933 had been fairly unpopular, probably more disliked than even Obamacare. More recently, the Medicare Catastrophic Coverage Act of 1988, a bipartisan bill, was intended to provide supplemental health care insurance for the elderly, but it also included a surtax on middle and upper-income seniors and was quickly repealed when the will of the majority of Americans was taken into consideration. Now, what is more dangerous than government that may err on occasion are supposed leaders that are incapable of recognizing error and taking a course of correction. Mr. Speaker, the Senate Democrats yesterday recklessly voted to disregard the will of the American majority and essentially endorsed a government shutdown rather than take any course of correction on what is a fundamentally flawed law that is raising premiums and already limiting access. In my home state of Pennsylvania, countless children in disadvantaged homes are covered under the Children's Health Insurance Program, or CHIP. The CHIP program originated in Pennsylvania and provides support to parents of these children to allow them to buy health insurance for their children from the commercial insurance market. CHIP program provides access to quality health care, not with government-run programs, but through a partnership with the private sector. Under Obamacare, these children are being ripped out of CHIP and placed in medical assistance, where the parents will be hard-pressed to find a pediatrician even willing to see, let alone treat, their child. Mr. Speaker, the unwillingness to admit the errors of Obamacare and take corrective action is even throwing America's most vulnerable children who are growing up in poverty circumstances under the bus. They deserve better. Now yield back.
The gentleman yields back. The chair recognizes the gentlewoman.